Kenya Coalition. My name is Dr. Violet Mbiti, and I'm joined here by my co-moderators who I'd like to also introduce themselves. So I'm Dr. Violet Mbiti from MNH Coalition, and we also have on board Fred Ochieng and Bunmi. So they can introduce themselves briefly, and then now we can commence. Over to you, Fred.
Thank you, Violet. As you said, I am Fred Ochieng from the Maternal and Newborn Health Coalition of Kenya. I'll be helping to moderate today to ensure the smooth transition of our session. Thank you and looking forward to a good day. Over to you, Bunmi.
Thank you very much, Dr. Violet, and thank you very much, Fred. I'm happy to be here today. I'll be co-moderating alongside Dr. Violet and Fred, and I'm happy to be here once again. And thanks to everyone who has joined so far, and I look forward to an amazing event. Thank you.
Awesome, awesome. So now we'd like to get right into it. I also want to welcome all the participants who have joined us from the entire continent of Africa and even abroad. Welcome to today's session, the peer-to-peer learning event. So first of all, it is important to recognize that today is Universal Health Coverage Day. It is commemorated every year on 12th of December. And it marks the date to call on leaders to make smarter investment and accelerate efforts towards health for all. In the world we want, everyone everywhere has access to quality healthcare, whether they need it without suffering financial hardship. And the coalitions in Nigeria and Kenya have been working toward this, even with support even from Evidence for Action, MamaYe Africa. And we have the MamaYe Collective, which seeks now to bring coalitions from together, because all of them have been advocating towards strengthening even health systems in the different states and in the different counties that they operate in. And today, all of them are here to share what they have been doing so that all of us can learn from each other. And even as a participant, you're welcome even here to even share the learnings. And if you have any question for any of the participants, you're welcome to ask, but that one will be at a later time. So right now, we'd like now to conduct a roll call to see which organizations are participating in today's webinar. So kindly share in the chat section, introduce yourself and the coalition you are representing, or even the organization you are representing, and it's from which country. Thank you. So we also have rules that we need to adhere to. So kindly mute your line so that it doesn't interfere now even with the presentations that are going to go on. And also the other thing that you should also consider is we are strict on time, so we'd like now to conduct everything in order. So you know, when you interrupt when someone is talking, that also takes a little bit of time from our side, and we'd like to eliminate that. And if you have a question to ask, there is a section that you're going to have a Q&A. You can raise your hands. So if you look on the right side of the Zoom, you see 3 dots, and then there is an option for you to raise your hand, so that even the moderator can even reach out to you so that you can even answer. And there's also a section for Q&A. If you have any question that you'd like to ask, kindly do so. So right now, I'd like to get right into it. We are entering the second part, where we are going to introduce panelists and a brief about their organization. So to start off, we are going to have 5 presentations. So I'd like to name the 5 presentations that we are going to have. So we are going to have Kaduna State-led accountability mechanism, who are going to go first, and they are represented by Mustafa Jumare. Thereafter, we are going to have Nigeria Health Watch, who are represented by Chibuike Alagboso. And then we also have Bungoma Ramka Network, represented by Moses Ouma, and MNH Coalition, represented by Judith Shutabule, and Yobe State-led accountability mechanism, represented by Mohammed Babakuchi. Panelists, remember you have 7 minutes each to share your presentation so that we can move to the next session, which is the Q&A, where Bunmi and I are going to ask you follow-up questions, and then we are going to have open plenary later on. So I'd like to introduce Kaduna State's mechanism. So Kaduna State's state-led accountability contributes to the improvement of maternal and child health services. It comprises of a coalition that includes the government together in that particular, in Kaduna State. So I'd like to also to just, for the viewers maybe from Kenya who don't understand how the governance system in Nigeria works. You know, the way in Kenya we have counties. In Nigeria now they have states. So each state, there is a way that they work towards even matters health. So right now, I'm giving it over to Mustafa Jumare to share his presentation. Mustafa, over to you.
Thank you, Dr. Violet. I want to welcome everybody to this event. Evidence-based advocacy on priority issues and achievement by Kaduna State led accountability mechanism called KADMAM. And I do the presentation, and the presentation outline looks like the little background about the KADMAM, how we work, our approaches and tools, contributions to universal health coverage in Nigeria, and advocacy priorities. And then we will later mention a little bit of challenges that we have, you know, in implementing whatever we do. Now, a quick background of it, like what Dr. Violet mentioned, Nigeria is made up of 36 states with about 774 local governments, and Kaduna State in particular is one of the 36 states, and it has 23 local governments, and we operate, you know, within the tiers in that area. So Kaduna State Maternal Accountability Mechanism, also known as the State Level Accountability Mechanism, abbreviated as SLAM, and was established since in the year 2015 by MNCH2, a body established by the then DPID, now the FCDO, you know, operating in Nigeria. KADMAM is a co-creation mechanism, which is made up of the civil society, the journalists, the professional association, traditional rulers, and the media. And our goal in that event is to try to contribute to the improvement of maternal and child health care services in Kaduna State by the year 2027. And the KADMAM has a constitution. Its activities are guided by the strategic plan and an annual operational plan, which is drawn from the strategic plan itself. And how we operate, we do that through advocacies, evidence generation. We generate evidence, sensitization, capacity building, media engagement, and resource mobilization for advocacy initiatives and outreaches. Our approaches and the tools that we use generally is political economic analysis, which is the PAR, and we also develop scorecard, and we also had budget performance review, and we develop advocacy briefs, development of indicators for tracking MNCH interventions, and then we also develop we conduct budget tracking and analysis for advocacy. And finally, we also do policy monitoring. Particularly example, I mean, a big example is the 255 primary health care facilities that are being upgraded by the Kaduna State government. Now, contribution to the universal health coverage across the state, you know, CADMAM has a robust evidence-driven engagements and with a good performance in terms of initiating and joining in developing the policies, you know, on health financing and healthcare financing. We also initiate town hall meetings with the citizens and the government. We also initiate public hearing with the Kaduna State House of Assembly along the line. We also encourage and then got the government to establish a law establishing the Primary Health Care Board, Kaduna State Contributory Health Management Authority, Kaduna State Health Supplies Management Authority, and many other laws that are related to health in that area. And then the employment of about 1,025 health workers from different categories in the health system, including the doctors, nurses, you know, community health extension workers, pharmacists, and others, you know, along the line. And then, of course, we also encourage the government to do this renovation and rehabilitation. Part of the challenges we had in the health sector is a lot of dilapidation of health system, you know, structures. And so we were able to get the government to rehabilitate 255 PSCs, which we have been monitoring and giving report every quarter. And then we encourage the government also to pick another 255 PSCs, you know, which is now on the making for this 2023. And there is also an increased funding in routine immunization and the institutionalization of quarterly open Kaduna health sector dialogue. We have a dialogue between us and the government, you know, and the citizen and the media, you know, to give them report on our finding in the health system, in the health facilities every quarter. And then we also have an increment of 15% Abuja Declaration health budget, which has been maintained in the last 3-4 years. And we want to also continue to maintain it along the line. And there is an involvement of civil society in the governance, you know, by including us into the board and of the parastatals of the government. And we have an existing 5-year strategic plan, which we also develop action plan, annual operational plan through that. We have a very good partnership with the government and we work very closely with the Kaduna State government. And fortunately, in the last 2 years, you know, as the co-chair of Kaduna Maternal Accountability Mechanism, I happen to also be the co-chair of Open Government Partnership, which is an international organization set up, you know, for co-creation of activities by the government and civil society. And we have also achieved a complete PSC under one roof in Kaduna State and scored all the 100% in getting the PSC to be all brought into one place, you know, for the state. And then there is also the inclusion, I mentioned that one, including Kaduna State members of the mechanism into the board and parastatals. So our priority for 2023 for advocacy engagement includes, you know, wanting to ensure that
you have 2 minutes to end.
All right, okay, all right, I'm almost through. You know, the sustenance of 15% allocation and annual increment and the continuous release of funds that are being allocated in the budget. And there's also, we want to also ensure that in 2023, we have created a budget line for MPD, SR, you know, in the state. And the human resource for health is required. So we want to encourage the government to employ more of the human resource. We want a release of family planning budget, you know, in the 2023, so that we can produce we can supply the consumables, you know, to the city for the health facilities to function. The social norms and cultural beliefs, attitude of health workers, we want to encourage that. And then we want to support the supervision of the health workforce and improve the uptake of the services, by the general public of the state. And we want to improve quality maternal and child health services in Kaduna State. Informal sector enrollment in the contributory health scheme, that is the insurance scheme, will be encouraged in the 2023. And here you have a quick pictorial view of our activities. This is health policy dialogue with stakeholders, Open Kaduna Health Sector, which we do quarterly, with the citizen, the government, and the media. And then you also have a high-level advocacy to the Deputy Governor of Kaduna State, was on the other side, a visit to one of the MDAs of Kaduna State, the ministry, one of the bodies of the ministry, to the executive secretary of the Kachma. And then we also have the health facilities spot checks that we do to generate evidence for advocacy. Thank you.
Oh, thank you, Mustafa, for the presentation. We now move to the next speaker, Nigeria Health Watch, which is represented by Chibuike Alaboso, and they are talking about solution-based journalism approach. Over to you, Chibuike.
Thank you very much, Dr. Violet. Sorry, I can't share my screen. Misha, are you bringing it up? Okay. Thank you. All right, so I guess my time starts now. So my name is Chibuike Alaboso. As Dr. Violet rightly said, I work with Nigeria Health Watch, and we were not part of the coalition, but as a learning event, this is a peer-to-peer learning event. I'm here to share the work we do at Nigeria Health Watch and how that supports accountability for UHC and accountability for maternal, girl, and child health. Next slide. So I just want to start by making two important points. First is our problem screen. Yeah, sorry, can the mic be mute? Sorry, someone needs to mute their mic. Okay. Okay, thank you. So 2 points before I get into it, that problems are always in our faces. Yeah, problem screen, and the things that are working, those solutions, efforts that people are making to address those problems, they don't always screen. They're not always in our faces. They're always at the guys at Solution Journalism Network, one of our partners in the US for one of our, the projects we're implementing here in Nigeria. They're the ones that, usually say this, and we use it in our trainings as well, that these solutions, these efforts, responses to various social problems, they respond. Next slide. But in spite of this, you will agree with me that people don't just fold their arms in the face of adversity, when they have problems. I'm sure most of us are familiar with this saying that when you push someone to the wall, they're likely going to, react. So it's based on these points that inform the work we do at Nigeria Health Watch. Next slide, please. So as a health communication and advocacy organization, we try as much as possible to influence health policies. We seek better healthcare for and access to healthcare for Nigerians and even beyond Nigeria. So we seek to amplify the great work that is happening in the health sector. We challenge what is not working and create a space for positive ideas and action. And that's why we are really happy to be part of this learning event today, because these are some of the platforms where we're able to share these ideas, share what is working. But one of our approaches, as you can see in one of the point on the line there, is that we share what is working. So we are intentional about sharing what is working. And that's an important approach for us as an organization, the solution journalism approach, because while we are always pushing for one thing or the other to be better, and as a health focused organization, we we work across a couple of areas, yeah, epidemic preparedness, universal health coverage, which the conversation today is about, maternal and child health, sexual and reproductive health, mental health, just name it. So while we are always pushing, pushing for government, pushing for stakeholders, private sector and all to invest in these issues, we're also being intentional about talking about the things that are working. And that's where the solution journalism approach for us comes in. Because for us, that's a way to spread what is working. Because if you keep on focusing on the problem, people are not going to learn anything new. Okay, so imagine this setting now. I will just go back to the presentation we just had. Imagine the previous speaker just came and talked about problems, all the problems in Kaduna State. We're not going to learn anything new, but he came and talked about some of the things they are doing, the accountability framework. I'm sure someone is already thinking, oh, what can I learn from this? What can we replicate from what Kaduna State is doing in Nigeria? And for us, that's why it's important to use the solution journalism approach in our advocacy. So this is not really a solution journalism focused class, but it would be good to do a quick run through of what it is. And sorry, previous slide, can you go back to the previous slide? So essentially it's that definition, what you are seeing there. It is rigorous and it is evidence-based reporting or storytelling, okay, on how people are responding to different social problems. Rigorous because it is not easy work, evidence-based because you don't just say someone is doing something when they are not doing it. You have to do your research, you have to state the facts, you have to put out facts and not misinform people. All of those put into a story of how people are responding to different social problems. And in this case, the learnings will be sharing around maternal and child health, around girl health, the girl-child health. It's what essentially solution journalism is. And it's important because, next slide, please. It's, okay. Next slide. And it's important because you're able to learn. Like I said, the previous speaker, he talked about what's working in Kaduna State. So that's what solution journalism does. It goes the extra mile beyond the problem to say, this is what people are doing to address problems. Okay, so when you learn that, you're able to start thinking, what can I learn from this to solve my problem? It gives people the ability to be part of that's the storytelling, sort of giving them agency. So you're reporting with them because they are helping to frame the problem. You don't just sit in your office and define the problem for them. They define the problem, how it is, and even give you tips on who is helping to solve it. Then accountability, which is the basis of what we're discussing here today. When you show people what is working, okay, and they're not learning from it to solve their problem, that forms a good basis for holding them to account. And to do the solution journalism properly, you follow their 4 important pillars. You talk about the response, what was done. You talk about the evidence of impact. So they are doing this. What is the evidence that it is working? What can we learn from them? That is an insight pillar, also very important. And then you talk about the limitations because it's not PR, right? Time you don't have all this, it will come off as PR. But if you have all these pillars, that's when you've done a good solution story. And that's the approach we use at Nigeria Watch in our advocacy. And what have we learned from this? Next slide. Over the past 5 years of, using this actively in our advocacy, while we're pushing for the things that are working and also talking about the things that are working. We find out that journalists are willing to rethink the contents that they are putting out. Usually people say, oh, journalists want to be sensational, they want traffic and all, but they also want to talk about the things that are working. We also realize that audiences want to see what is working. So demand what is working. We see that demand. The audiences are just exhausted with negative news. They want to see what is working. It's also a good form of holding people accountable and promoting inclusive reporting on issues because you're able to cover. It's just an approach that can be applied to everything, every form of reporting. Next slide, please. And these are just a few examples of the stories we have done where we've seen the real strong impact of solution journalism, how communities are coming up to solve their problems, how young people are helped respond to the COVID-19 pandemic when it started. And we realized that these stories continue to receive good engagement. The first one is around the PAC that was renovated, and the one close by it was in very bad shape. But after my colleague did that story, a couple of months later, probably other things played into that, but a couple of months later, we realized that there was a change in the other PAC. Those are some of the things, next slide please, that you see when you use the solution journalism approach to do your advocacy. So essentially, next slide, please. My call to action after this will be, the learning I want us to take away from this is that we should rethink, especially those of us who commission journalists to do stories, those of us who are advocates, who are CSOs. Rethink the way we disseminate content. So don't just focus on we did this, but think of what can others learn from that thing that you did. Stories that show what you did, how you did it, who benefited, and limitations that you faced. And also as audiences, as consumers of this information, we should demand for more solutions-focused stories, because that way we don't have a media space that is just filled with problems. So yeah, those are our learnings from Nigeria Health Watch, and I'll be happy to answer any questions that I didn't cover within this short time. Thank you.
Thank you, Chibuike. So I'd like to hand over to Bunmi so that she can introduce now the coalitions from Kenya. Over to you, Bunmi.
Thank you very much, Dr. Violet, and thank you to Chibuike for that amazing presentation. So right about now, I'm going to introduce the next presentation, and that is from sorry about that. So yeah, so that is from the Bungoma RMN-CAH network, and they'll be making a presentation on reproductive, maternal, newborn child, and adolescent health network, whose goal is to improve the RMN-CAH outcomes in Bungoma County, Kenya. And they'll be doing this, or they are already working on this, as using global public goods as advocacy tools in advocacy, and working with the media. So I would welcome the learnings that we can get from this presentation. So right about now, your time starts now, please. You have 7 minutes for this presentation. Over to you, Moses.
Thank you. I hope you can get me, Bunmi.
Yes, I can.
Okay, my name is Moses Ouma. I'm a member of Bungoma Ramka Network, which is a loose network that operates in Kenya in Bungoma County, which aims at improving the Ramka outcomes in Bungoma County. And when we talk about Ramka outcomes in Bungoma County, we have 3 priority areas. We want to reduce teenage pregnancy and also strengthen the referral strategy. And the 3rd priority area, we want to increase the uptake of the 1st and the 4th antenatal care. And through that, we support and champion for improved of these standards in our county. We've been able to make good use of the resources that have been allocated to us by various stakeholders. And I would like to talk about the stakeholder Evidence for Action MamaYe, who was a series of resources that we've made good use of them at the Global Public Goods Hub, which has played a role in ensuring that the network acquires learning resources that we use in our reference during our advocacy activities. And these materials, we use them as guidelines in order to understand the stakeholder dynamics and mechanisms of bringing change in terms of influencing decision makers on either budgetary allocation and health services. Then we see that there are various resources that we use, and for example, making use of the advocacy handbook, it has various relevance because we see our network engages with the government and other stakeholders for effective and successful achievement in order to realize our steps to change, which is our guiding document towards our advocacy work. How do we engage with our partners, with our stakeholders and the government? It's through building partnership. We are working with others well, and we're taking the approach of evidence-based advocacy, where we gather evidence and disseminate to develop scorecards and evidence material that we use to engage our decision makers. And also we think and work politically. And the engagements that we get, we have the meaningful engagement during public participation. We also have the presentation of the health scorecards that we've developed by the support from the Ministry of Health in terms of the county government. We also develop policy memos to engage decision makers during public decision public participation and development of evidence brief in order to inform our advocacy. And we also conduct strategic media advocacy campaign, which amplifies our activity work. And also another resource that we made good use of it is the health budget advocacy toolbox. It has very strong relevance to advocacy success, because through it, the network underwent a training on county and national planning, plus budgeting processes based on the PMF Act of 18 of the year 2012, which has a provision to build members' capacity in order to familiarize with budget advocacy. And then with these skills, members of the network can be able to develop policy memos, letters, media advocacy campaign, because our network incorporates the media personnel, scorecards, and expenditure brief, which will inform our advocacy. And also looking at another resource that has played a role in our advocacy work is the MPDSR tool tracker, which we use it to seek commitments to track the actions that were put in place by our leaders. Next slide, please. By the decision makers, and such information in form of maybe numbers, statistics, and case studies is what informs the networks on what we want to do or the interventions to put across. The network participates in MPDSR committee in 3 sub-counties within the county, which is Sirisia, Webuye West, and Kandui, and actively participate and takes part in the committee. The other resource that has played a good role is the guide to coalition building. Through this guide, we've established mechanisms to ensure that our network is registered within the jurisdiction of the Bungoma County, and it provides a clear journey and outline to sustainability, how to sustain the coalition, and how to establish all the guiding documents, leadership and governance policies, and the documents that are required to support our coalition. For example, we are guided by the terms of reference, which predicts our interaction, and we have finance policy and all other policies such as the sustainability framework. Maybe the next slide. And through these resources, we've been able to see the success stories in our coalition. For example, we have milestones. In the county, you have the allocation of the Kenyan shillings 15 million for the construction of the regional blood center for the county, because we've been depending on the regional blood from Uasin Gishu County. This will play a role in reducing the cost of our expenditure. Also, allocation of 10 million to blood bank services. We also have increment in budgetary allocation towards community health strategy to promote the tracking of antenatal care, development and presentation of evidence scorecard. It's an ongoing process that the coalition takes part, and we also have increased county allocation of Kenyan shillings 97 million towards the RAMCA programs in the financial year 2022-2023. Then we also have the relevance of the hub towards the media success stories. The media and the journalism play an important role in the coalition advocacy work. We see that to bring visibility, the media has to be well placed, therefore enhancing the proper use of well-trained journalism for smart health reporting. We've also been able to secure a grant, which it's an ongoing one. We are currently implementing primary health care from funding by the PHCPI. The network has been able to train community health volunteers and a number of media personnel to become champions for primary health care. And we've been also able to share some video stories with our coalition so that other members, other people from other parts of the world can be able to see the success stories of our coalition. Thank you. My name is Ouma.
Thank you very much, Moses, for that amazing presentation. To the attendees, to the delegates, kindly prepare your questions in the Q&A section. We'll have another session. We'll have a following section after this for your questions and answers. So next we'll have the maternal and newborn health presentation, which is by the maternal and Newborn Health Coalition Kenya. And this coalition, Shitabule, I hope I pronounced that well. If I didn't, you can find me later. So yeah, I would welcome Judith now to make her presentation. Thank you, Judith.
Thank you so much, and I welcome each and every person.
Yes, you can go ahead, Judith.
My name is, as she has just called, the Maternal Newborn Health that started with individual organizations. As you can just pull off the next screen. As you can see on the screen, we have just small papers and people working on them. That is exactly how our organization started, by just individual organization and individual persons with individual organizations coming together so that we can be a strong team, for we had a common goal. And our goal was just to reduce maternal mortality. And therefore, you can see as we are coming together, you can see on the other side of the slide, you see that picture. And when we are coming together is now when we are becoming strong, and that we can do our advocacy work promptly. So as you can check on the next slide, you see that we started that way, and that was our formation. The way we started as 8 grassroots organizations plus representatives from the media, and it was in 2020. We worked as a loose network until recently, when the government agreed to give us a letter of no objection to just legalize our coalition. Next slide. This coalition cannot just go on without any guiding documents. And that's why you see in that slide, we have guiding documents. We had terms of reference just to bind us and bring us together with that goal. And you can see it's not just that document only, but we have also a document called a strategic plan. You cannot go a mile without a plan. You need to have a plan so that you can go much forward. And we are talking as today, we have also policies that guide us to build our coalition. We have policies like finance policy. We have resource mobilization plans. We have that resource mobilization strategic plan. We have other plans like steps to change. We have also a conflict and resolution policy. We have a resource mobilization strategy. We have a strategic plan, as I mentioned earlier. We have anti-fraud policy. We have also advocacy and communication strategy. And also at the moment, we are having a constitution, because now, since we want to legalize our coalition, we have gone to now have a constitution. And on that, we have also committees that are governing our coalition. One, we have an executive committee, which comprises of 7 people. And also we have a resource mobilization committee, and we have a discipline committee, and we have a group of trainers of trainees. As you can check in the next slide, we've got some achievements. And these achievements, we are being recognized by the relevant government authorities like Health Sector Working Group, County Health Management Team, and other partners whom we work hand in hand together. As you can see that picture just beside it, it's in the group when we were doing the current CIDP of the County of Nairobi. CIDP, I mean County Integrated Plan. That was we are doing for the next 5 years. And also we have an achievement that with this recognition, we have been members of MPDSR, that is maternal perinatal death surveillance and response, in some of the sub-counties within Nairobi. And through that, we were privileged to have a reduction of one of the facilities, and it's a referral facilities for maternity, but we had a reduction of 0, just 0 maternal mortality. that is in Pumwani Health Center for 8 good months. Last 8 good months, we had no maternal death. And that one, it really motivated us more and more, as even we were presenting our memos to the county to include more and more. When we come to skill retention, we've been mentored by E4A for some time. They have been mentoring us, they have been giving us skills. And for us, we said that these skills should not just go relevant, but we need to have the trainers of trainees who are now capable of cascading the knowledge to the other people who are joining us and the other members who doesn't know, and the other organizations who are ready to learn with us. And also we've done exchange visit, and this exchange visit is not just a walk.
Oh, please, Judith, thank you.
It's a learning process. It's a learning process. So we do that cascading, and also we do the learning processes. And as you can see, this is a great achievement when we are now recognized by the county government, where they do welcome us, and that letter beside that screen is just the welcoming as of the needs to show that we are really. And in every steps that we do also have challenges, but we have to go beyond the challenges and just meet our goals. Like one of the challenges we have had so far, 2 organizations dropped out of their coalition, and one being that they did not align themselves with what we were doing, so we couldn't work together. And the other, our coalition does not just take individuals, but it takes organization. And for them, they had come as individuals, so it couldn't work. Then we have also conflict of interest. You have some members, they just want to work on the organization, but not as a coalition. They put much on the organization other than their coalition. So that has become also a challenge, and we have inadequate resources sometimes. But it doesn't matter, even if we have some such challenges, we have to work out and know what to do. Like inadequate resources, there's a time we had resource mobilization team wanted to get to have their meeting, and then you find that there was no seats, but we tried as much as possible to use the available materials, where one organization internal resource mobilization. And in everything we do, we just have to move forward. We cannot just start and think. So we have that step so that we are moving on, that when we are starting, we think, we analyze, then we plan ourselves, then we try to practice what we do, then we continue doing until we get the success. That is the end. You can click on that link and you will find everything that I've just spoken onto that link when you click. Thank you so much, my listeners.
Thank you very much, Judith. That was an amazing presentation. So just as I said earlier, kindly share your questions to Judith, Chibike, Moses, and the other presenters in the Q&A section. So I'll hand over right now to Dr. Violet for the last presentation of today. Over to you, Dr. Violet.
Thank you, Budmi. So at this juncture, I would like now to introduce the last presenter, Mohammed Babaku Chichi from Yobe State-led accountability mechanism, who are going to talk about citizen participation in the budget making process. So just a brief about Yobe Voice and Accountability Mechanism. They were established to advocate reforms in the health sector that will lead to better health outcomes. So over to you, Mohammed, so that we can get to learn more about Yobe State-led accountability mechanism. Thank you. Mohammed, kindly unmute your mic. Okay, seems like he's not there. Maybe I can take you through the rundown of their presentation. So they're talking about citizen participation in the
Violet.
Yes.
Maybe they have someone else from their coalition in the session. Maybe they can notify us quickly on the chat and they can speak on this.
Yes. Thanks, Meshach. Do you have a representative from Yobe? I saw there was someone from Yobe in the chat. All right. So we are not able to get Yobe. So right now we are going to the Q&A. Dr. Adamu Mwazu has said he's from Yobe. So he'll present on behalf of Yobe. Mesha, kindly project the screen so that he may present.
Okay, let me make him a panelist.
Thank you.
So I can see two people saying Kuridat Kashim and Dr. Damu, who is presenting.
Dr. Adam is saying that the mic has been disabled for him.
Yes, working on that.
So listeners, we are resolving the issue in a minute, so just bear with us. So once we finish with the Yobe presentation, we are going now to Q&A, where the moderators are going to ask follow-up questions to the panelists. And thereafter, we are going now to finalize on the open plenary. Yes, so over to you, Yobe.
Hello.
Hello, we can hear you. Kindly proceed.
Okay. Good evening.
Hello, Adamu.
Yes, sir.
I will present.
Okay, go ahead.
Okay, Mesha. Okay. We encounter while trying to join. However, we are sorry for starting this late. Assalamu alaikum. My name is Mohammed Bab. On behalf of Yobe Voice and Accountability Mechanism. Mesha, can you hear me?
Okay, also kindly tell the person behind you in the same room to kindly tell them that you are presenting, because we are hearing noise. We are hearing their conversation.
Okay. Hello.
We can hear you. Kindly proceed.
Okay, let him go to the next slide, please. Establishment and focus. Yobe based on accountability and 16 as your sum. Yobe State lead accountability mechanism, but we identify another platform doing the same work. So we reach out to them and then we match together to become Yobe voice and accountability mechanism. Amplifying citizens' voice in health governance and then advocating for transparency and effective delivery of the level we have reached is that we have a very cordial, sound understanding and then acceptability by stakeholders, the citizen, the government, other civil society organization, on the role the citizen can play in ensuring transparency and accountability. How we work as a non-state actors, our primary role is to sensitize on government policies, programs, and then for them to key in. We also carry out evidence generation for the purpose of advocacy. We also conduct evidence-based advocacy in order to have issues solved. And then we also engagement. Our approaches, well, we do this whenever we want to have issues solved. We map influencers, stakeholders who can contribute or who can influence changes. We go further. We also conduct budget tracking and then analysis of the budget. Analysis of the budget. We also carry out health budget performance review to review the performance, how far funds allocated for the being accessed, and then this and that. We also develop scorecards for stakeholder engagement. Also partner with other like-minded organizations, talking about women-led organization, to advocate. The objectives of citizen participation in sectoral response to citizens' health need in order to achieve universal health coverage. What do we mean here? Yobe as a state is, as at the time this platform was established, the state was coming out from the destructions of Boko Haram, this and that. So health need of the citizens in the after this and what have you requires multi-sectoral approach to be able to achieve universal health coverage. Another objective we have is to enhance, talking about internally displaced persons, pregnant and breastfeeding mothers, people living with disability, and also to reduce wastages. How do you reduce wastages? When lean public resources are expended on the priority needs of the citizens, that reduces wastage. Levels of participation, how does these citizens participate in the budget process we're talking about? The citizens participate in the budget process in two ways. Firstly, indirectly through the voice and accountability and other civil society organization. Directly by coming together with government stakeholders. In the indirect citizen participation, the civil society and the rest do conduct citizens need generation from communities across the state. Now, these generated needs are now prioritized, ranked, and then shared with the concerned MDS for inclusion into their during bilateral budget discussion at the State Ministry of Budget, citizens get to critique, get to confirm whether they are actually included in the budget for implementation. For the budget ministry organizes zones of the state. So citizens are invited there to come with their needs, to have their achieving universal health coverage using the response to citizens' health need in Yobe requires multi-sectoral. As community-based organization, as civil society, as advocate, we sensitize maternal and child diseases during our community engagement. Now, when we prioritize these ranks, we government MDS would for the health. For instance, when we engage health and engage them with issues around MNCH and then human resource for health. And for Agri MD to prioritize in their proposal interventions that will improve nutrition. For the water sector, we understand that a lot of child killer diseases are attributed to poor. Advocate to them to prioritize wash in their budget proposal. The works and then housing MDS, we advocate to them to provide access road to facilities, access road to communities where facilities are situated. We advocate to them staff quarters for health workers in rural communities in their mass housing programs. And coming to our achievements, Yobe has an allocation in the health sector that is meeting the Abuja Declaration in 2018. In 2019, Yobe carried out a rapid during cholera outbreak in Bede local government, and we use the outcome of that assessment to engage stakeholders. In 2020, Yobe produced IEC materials on COVID-19 and then engaged about 34 communities across the state on the issue of COVID-19. Yobe also on the effective provision of primary health care services while responding to COVID-19 pandemic in 2020 and netted findings with stakeholders. Yobe has also immensely contributed to the establishment of healthy MDAs, talking about management agency, drugs and medical consumable agency, the newly established state ambulance services, and then talking about standard and quality assurance agency. These are some of the into the health sector as advocated by UVAM, even though they vary from 15 to 11 to 9, this and that. And currently, UVAM is a human resource assessment. After the assessment, we are going to address on the need for equitable distribution of human resource for health between facilities in urban communities, high volume facilities, and then low across the 588 health facilities in the state. We encounter as a platform is that changing government priorities affects how we. Before 2019 election, before the advent of a new government, the former government's priority was health. But with the advent of this government, their priority shifted from health to a
You're breaking. You're breaking. We can't hear you. Kudirat, you're breaking. Seems like he's done with the presentation. So now we are heading over to the Q&A question, where we are going to ask the panelists questions and they will answer. So right now, I have a question for Kaduna. Two questions to be precise. Kaduna.
Yes,
how
please,
do you ensure the state health budget remains at 15% and above? And how was the journey like? And what role did advocates play? Mustafa, over to you.
Yes, I have heard you. I have heard you. Yes, thank you very much. I think, I have said that, in the last 3 years, we have been we have maintained the 15%. Actually, we do that through a town hall meeting, where the government actually presents its own draft budget to the citizens, and we will be around. And by the time we analyze the budget, the draft budget, we will now raise issues at the town hall meeting with evidence, so that, before this document reaches the House of Assembly, the government will look at our own issues and then maybe address it. And then when it goes to the House of Assembly, where laws are made, where the appropriation is approved, we also follow them and then also attend to the public hearing. And during the public hearing, we still insist on our own earlier observations. And we also advocate for the House of Assembly during their discussions on the budget to try and address the 15% health budget. More so, like what I said, the political commitment by the government, generally on health is a plus to us, because 3 areas in Kaduna State are being prioritized. We have education, health, and agri. And during all these 3 areas, they try to meet up. For instance, in health, it meets the 15%. In education, it means the 25% or 26% of the budget allocation, of the overall state budget allocation. And so we try as much as possible through all the performance analysis that we do quarterly, try to come up with a document that we will use at the end of the year, when the budget is being prepared for the coming year. That's how we try to maintain the 15%. allocation. And we do that through a lot of advocacy, through town hall meetings, through public hearing in the House of Assembly, and then continuous analysis of the activities under the health budget to ensure that, we are not being missed. That's how we have been doing. Thank you. Over.
Thank you so much, Mustafa. So now I have a question for now another panelist, Nigeria Health Watch. So kindly share further about the advocacy and communications program of the Giving Birth in Nigeria campaign and what was achieved.
Thank you very much, Violet. Can you hear me?
Yes, we can hear you.
Okay. Yeah, thank you so much for the question. So essentially, yeah, like I said at the beginning, we are a health communication and advocacy focused organization. So the Giving Birth in Nigeria project, it's also a communication and advocacy project. And essentially the main focus is on, pushing for better maternal health care in Nigeria. And essentially, like the name you mentioned, giving birth in Nigeria, how do we make sure that women are not dying when they are giving birth? What are some of those issues? How do we help amplify those issues? But while we're amplifying the issues, also being intentional about putting out the things that are working, like I mentioned in my presentation earlier about our solution journalism approach. So it essentially started with a community-based assessment we did in 2019. And these are some of the outputs, because even in advocacy, you need evidence to advocate, to talk to stakeholders, both those at the high level, the policymakers and all, and even community members. So the community-based assessment helped to answer the question, why are women dying? What are some of the issues? And I'm happy to even say that there's a report on that, that we'll put out on our website. So as far as achievement goes, like this is a tool that advocates can use to help, to help them understand some of their issues, some of the issues that we found out, and also to help frame their messaging as a communicate, or they are advocates. So in that, asking those questions, going into communities across 6 states in Nigeria where the project was implemented, interestingly found that over 66% of women deliver in communities, in those communities that were assessed, and 34% deliver in health and in facilities. So the report essentially had recommendations around how to mitigate all of these issues. Also, another phase of the project also focused on quality of medicine, because there are so many things that can lead to, with women dying when they are giving birth, beyond the quality of healthcare they are receiving, access to health facility on time, human resources for health, that's the quality of health professionals that are treating them, the medications that they receive, because we know postpartum hemorrhage is a major issue in pregnancy, especially in pregnancy complications. So those medications, commonly called them uterotonics, they are very important. But how do we make sure that they are of good quality? Because it's one thing to get a medication, it's another thing to get medications with the right quality. And it all starts from procurement. How are they procured? What are the processes? So that phase of the giving birth in Nigeria, focused on that, the quality of medicines for maternal health care, and all of those advocacy centered around what are the issues, what are the key issues, how do we mitigate against them. But essentially, like I said, one of the key things for us, beyond all of these issues, we are very intentional about talking about things that are working. So on our website, we have series of stories from this project around interventions, both community-led, both technology-based interventions that are helping to improve maternal health care. So you see, like I said in my presentation, while we talk about these issues, we also balance them by talking about the things that are working. So that's also an important output from that, from that advocacy and communication project, the Giving Birth communication and advocacy project, but also those evidence, those reports that are out there that can be used for other advocates, for the media to continue the conversation. Thank you.
All right, thank you. So I'd like to ask now Yobe, a question. Kindly keep it brief because of time. So we'd like to ask, what was the result of your engagement with government on renovating health facilities? And what tools did you use in that advocacy? Yobe, who's going to respond? Yobe? So as Yobe state mechanism organize themselves, I'd like to hand over to Bunmi so that she can ask now the Kenyan panelist questions. Thank you.
There's something from
Hello.
Yobe. Yeah,
Can I respond to this particular question before you leave?
Yes, yes, kindly do, kindly do.
Yes. Usually, when you have, part of the challenges we have in the health system generally in Nigeria is that, we have a lot of dilapidated structures, the health structures generally. Some of the hospitals are really not being renovated for long and what have you. So what we usually do in Kaduna State, Kaduna Maternal Accountability Mechanism is we try to do an evidence-based analysis. We go around and see physically those facilities, how does it match with the standard? And what are those things that are really lacking? And it was based on that the government says, okay, we are going to buy into the government, the national government policy of one health facility per ward. In other words, we have over 1,069 health facilities in Kaduna. The government picked 255 first. One from each of the wards that we have in Kaduna. We have 255 wards. And then following that, we went around and checked on those 255 facilities and identified those things that are missing, those things that are lacking, that are requiring this. And then from there, the government actually used its own machinery to prepare bills, so that, they contracted it out. And then when they released the contracts to the contractors, the mechanism actually follows through all the 255 facilities every quarter to ensure that the work is done effectively. And this has been done to the tune that, today we have 255 facilities completed, and the government has again picked up another 255, one for each of the ward again. So in essence, we are a little over the national policy of one per ward. We're now aiming at 2 per wards, based on the analysis that we do present regarding the health facilities. And I'm sure this is common to most of the mechanisms that are working in Nigeria. Thank you.
All right. Thank you for Kudirat for answering the question. Now I'm handing over to Bunmi so that she can follow up with the other panelists. Over to you, Bunmi.
Thank you very much, Dr. Violet, and thank you to the presenters. So I'm going to be asking right now, I'm going to be speaking with the Bungoma RMNCH network. So my question is for Moses. So my question is from, this is a peer-to-peer learning event. So based on your presentation for the purpose of cross-learning, what challenges were experienced by the network in the process of advocacy and partnership building? And from these challenges, so what learnings are available, for similar groups in other countries like Nigeria, Ghana, South Africa, Kenya, other countries?
Thank you, Bumi. I hope you can hear me clear.
Yes, we can.
In the advocacy process, the focus is always on the milestone, but we cannot turn a deaf ear on the challenges that we come across. And I thank God that as a network, we've been able to explore the resources that we get from the Evidence for Action MamaYe to come up with measures to counter the challenges such that they do not amplify their voice in our advocacy work. And to talk about the challenges, we have the changing political dynamic. Maybe you're expecting some leader in office today. Tomorrow, when you wake up, that person is been replaced by someone else. Therefore, the coalition needs to do political economic analysis to develop mechanisms and approaches in how to develop the new leaders who are coming in office, and maybe you find us doing our advocacy work. Also, a challenge comes during a budgetary allocation. Maybe we are advocating for an increment in RMNCH services. The government pledges to influx given finances. When the finances are allocated to the program, you find that maybe there'll be late release such that the program will continue to suffer some bottlenecks. Yeah? So the late release will affect our advocacy work towards seeing an improvement in maybe the RAMCA outcomes in the Bungoma County. And maybe sometimes there is what we call a mispriority of the funds. For example, a given amount of money is released to a given program in health. You find in some cases, we find that money is redirected to another program, say maybe roads, and that money was meant, let's say, for family planning budget line. So you see the part of the sub-program of the RAMCA continues to suffer due to taking of money and replacing it with another program that it was not intended for. And also financial constraint as a coalition, as we are engaging in our advocacy work, we find that we do not have enough funds to run the advocacy work effectively. Therefore, we also deal with that by partnering and working with others well, co-creating activities with other partners and the stakeholders, for example, the county government. Today we've marked our universal health coverage by partnering with the county government of Bungoma, and also the stage media arts are working together with RAMCA under the project of primary health care initiative. Thank you. Those are some of the challenges that maybe I'm able to highlight. Back to you.
Just to add to Bungoma, I think we have similar challenge here in Yobe. As I said earlier, changing in government priorities is a challenge for us. We're prioritizing health as a coalition, while the government's priority is in another sector. This is a big challenge for us. Another challenge we have is that of attrition. A lot of government stakeholders who have undergone a lot of trainings, a lot of advocacies, this and that, they get retired or get transferred. And then those coming to the new office, those who are coming to the office newly, lack understanding of our work. We just have to start everything all over again. That affects our work. And then talking about funding, as a coalition, funding is a major issue for us. That is why we are very much concerned about local resource mobilization capacity to mobilize local resources to be able to do our activities without looking for outside funding. Thank you.
Thank you very much. Thank you very much for that. So I think it's time to move on to the next questions, which is the final questions for today. So my questions are for Judith from the MNH Coalition. So this question is, from your presentation, what level of, multi-stakeholder collaboration was done at the local level and probably at the state and national levels, and how did this collaboration influence the MNH outcomes for the varied stakeholders and beneficiaries? So if you're able to, just give us a brief lowdown of that in 2 minutes, that would be great. Thank you, Judith.
Okay, thank you very much for your question. if I've just gotten your question while you're asking how we've done the resource mobilization inside the coalition and at the government entities. Now, what we've done actually within ourselves as coalition members, we've looked at ourselves and do just a small resource capacity. And we've known each organization, its strengths through organization capacity assessment. After that, we know this specific organization, they can do this because they're doing this and this and this and this. And we are partnering with the government in a way that we actually know that ourselves on our own, we cannot do what is necessary. Yes, we need it, but we cannot make a decision. Even though we can amplify our voices and we can tell them if we have this and this and this, they can, but they will make the decision. And that is where now the PEA comes inside. That when you are looking at these political entities, how are they influencing our work? So as you map these stakeholders, you do it according to the high influencers and then high decision makers and that passion. What is the passion behind this work? For an example, our current governor in Nairobi, has passionate over health in general, not only Ramka, but health in general. And it's a man that is approachable. So when we do and we approach him, tell him now, see, this and this is working. And then our media amplifies these things. Openly on media, it's seen. If there is a mother dying somewhere, the media will just show up. This has happened, and then as an advocate, you come in, then this one are coming in. So we are partnering, we are doing the round tables to make the decision. And you find they give even support supervision to actually, the work will go smoothly. Thank you.
Thank you very much for that. Thank you so much for that, Judith. So I think it's right about time to give the delegates and the attendees their chance to ask the presenters questions. So I think I'll hand over right now to Fred to lead that segment. Thank you, Fred.
Thank you, Bunmi. Thank you, Violet, for sparking up the great discussions. So it's time for Q&A and for open plenary. But first, I want to thank all who already queued their question in the Q&A box. And in the interest of time, as I will be reading them out, I hope that the panelists will be listening. And as we answer, please let us be brief in responding, but to the point. Please, again, let's be brief, but to the point, so that we can give more time to our participants and or rather our listeners. So I can see that the first question, although I can't tell who it is saying anonymous. The question is for Kadmam. But before we get to these questions, I would like to hear from the participants what their thoughts are about today's sessions and the presentations that were brought forth. So this is your chance to air out your views or to give out your comments. And I would like to begin with Dr. Adamu Muazu. I hope that I have pronounced it correctly. Dr. Adamu, over to you.
Thank you very much for the opportunity. Actually, I found this peer-to-peer learning event very resourceful, a very good opportunity where I will learn from my colleagues that are working across other places, so that I will improve my skills, I will improve my knowledge on how to advance the work of civil society in my locations. And I hope this kind of engagement should not be happening once in a year. I strongly recommend that it should be done every quarter, so that we will acquaint ourselves with more knowledge to be able to carry out our work very efficiently and effectively. Thank you very much to organizers, and thank you very much to the panelists and the presenters. Thank you, I'm out.
Thank you, Dr. Adamu, for that. It's still open to someone else. I can see Hawa Saulawa. I hope I pronounced it well. Hawa, over to you. Hawa, I can see your hands up. If you can hear me, it's your time.
I think
How can you hear me?
Look at the chat, please, Fred. There's a message there for you.
It's directed at us, Yobe. So let me reprioritize before we engage. We generate citizens' need from communities across the states. We do what we call prioritization and ranking, because the health MDS in Yobe have their different mandate. The primary healthcare management agency has its own mandate. The hospital management board has its own mandate. And then the other MDs, they all have their own different mandate. So these needs we're getting from the community, we prioritize them based on what goes to what MDA, what goes to primary healthcare, what goes to primary hospital management board. And then we also share with other non-health MDAs, as I explained earlier. For instance, the Ministry of Works and Housing, we take citizens in regard to human quotas for human resource for health, access to health facilities, access to health facilities, this and that. So this is what we mean by prioritization and then ranking. Thank you.
Okay, thank you for that. Dr. Landry, I can see you in the house. Kindly, would you ask your question to the relevant presenter, please? Over to you, Dr. Landry.
Oh, okay. Good afternoon, everyone. And it's a pleasure to be here. I'm Dr. Landry. I'm the, the technical advisor for the Southwest State on health system strengthening and co-chair for LASAM, SLAM Lagos. We've been having some challenges and getting some activities done based on some internal bottlenecks and all that. I just wanted to know from the other slums across the other states in Nigeria, even beyond, across the countries in the continent. How do you ensure avoiding some issues and in terms of being led? The state accountability mechanism is a platform that should be a bit detached from government in a way. How do you ensure that it's not run by government? And is it true ensuring that when you come up with some strategic document and your TOR, avoiding some key executive position for the government, or ensuring that the executive position are actually taken by the CSOs, or a bit of mix? How do you manage? How have you been able to manage some bottlenecks, knowing that government structures can be quite well established, and then it's always good to leverage on some of those structures, but when it's run and then it's being tossed here and there by government, how do you deal with that?
Kaduna.
Who will be taking it up to answer the question kindly?
Kaduna.
As we go to the next.
Okay. Let my senior colleague answer, then I will add it too. Mustafa, you can go ahead to answer.
Thank you very much. Kaduna had a big experience, and indeed, this is something that we want to sell out to every state, every country. This is a global practice of co-creation, and that's why we have the open government partnership. The co-creation is a setup that is being built between a civil society and the citizens, between the civil society and the government. And they have to work together because we are all citizens. I was in the government before today, and I've been off government. Now I am independent. But I still contribute in the health sector. So what I'm saying is that the co-creation principles is that, you have to give, that's why we are called co-chairs. There are two chairmen, one from the government and one from the civil society. And the two of them chair the meeting. And as such, we connect with the citizens' needs, and the government also provide what they can do, to address those needs. So in essence, There's no way that the government is going to swallow you, you know, or take over all that you do, irrespective of that. What you do, you have an evidence for whatever you are saying. If the government is not doing what they have decided to do, I mean, the citizens have to have the right to call their attention to it. And irrespective of whether the government is part of it or not, you will have to do that. And honestly speaking, with the government in the co-creation, there is every possibility that, you know, data, information that you require are easily got from the society. And that is globally why now that, you know, the governments are encouraged to join into the open government partnership. Minus even the accountability mechanism that we have on the one side, so that, you know, we can all the time work together, you know, for the benefit of the citizens. You know, there is no way that the government is going to take over the activity as it is. We are independent. Our office is not in the government office. Our activities are designed by our constitution. We have the way of, I mean, we have our rules that we have, like what you said, the terms of reference are being spelled out by us, you know, and then we are following it strictly. And our source of funding is not the government. We will continue to generate resources outside the government and then, of course, implement for the government. And that's why, for instance, in Kaduna, you know, whatever the government will do is say, okay, Cadman, please come and join us so that we can address this issue and we work together with them in that order. They are not going to convince you to say a lie. You have to say what is there as a fact, because there are traditional rulers in us, there are religious groups in us, there are professional bodies in us, and then we can bring in the people from the civil service in us. And all in all, you know, we try to practice in that order so that we can address those people. So there is no way that they can prevent you from doing what you are supposed to be doing correctly in that order. I hope I.
And just to add to what my
Thank you,
senior colleague has
thank you, Mustafa. I kindly ask that the panelists would give me time. I want to allow the participants, I would like to hear from them because we already heard from you. So kindly let me take lead on this so that I can get to hear a lot from the participants, then your time will come again. Thank you. So I would like to invite Achola Matthews, a journalist. I can see that you've chatted there. Would you kindly share your experience? Over to you, Achola. Chola, we didn't get you. We're struggling to hear from you. Might be a network issue. Would you like to try again? Okay, it's quite unfortunate we can't get to hear from him well. So maybe I can read, he said that great presentations have learned a lot from Nigeria's Health Watch in terms of solution journalism to improve healthcare instead of only focusing on problematic issues. Well, thank you so much for that, Achola Matthews. We appreciate your comment. Participants who are listening in, please raise your hand if you have an input. We'd like to hear from you. But I would like to go to Mariam Mohammed. Mariam Mohammed, would you like please to share your experience or give your inputs to the presentations that we just had? Welcome, Miriam Mohammed. Seems like we can get her too. Anyone else who would like to take up, please? Anyone who would like to give their inputs as we get to wrap up our session? I can see Aisha Joan. Thank you for joining us. Thank you for joining us. Anyone else who would like to pick it up from that point?
Yeah, you have a hand from Mohammed Mubarak.
Mohammed Mubarak. Mohammed Mubarak, over to you.
Okay, thank you very much and good evening, everyone. I'm Muhammad Mubarak, the Assistant Secretary for the Bauchi State Accountability Mechanism, that's BASAM, one of the few states that IFOA has worked with, or yeah, right from the inception of the project to, I think, sometimes August this year. So mine is actually just to, I'm actually happy when I hear the discussions from the panelists, and though I joined a bit late, but I got some part of it, and I'm happy with what they're doing. So it's just, a goodwill from everyone at BASAM, telling them to just, they are doing a great job and they should just continue, and then feel free to reach out whenever the need for such arises. And kudos to the entire options for MamaYe team for this support. Thank you very much, and have a wonderful evening.
Okay, thank you. I can see, I would like us to get Yobe State there. I'm going back to the Q&A. So Hawa Salwa asked a question. So please explain the prioritization and ranking in the indirect level of participation. Question directed to Yobe State. Please take it up from that point.
I think I have answered this question. However, let me check it again. What we mean by prioritization and ranking is that when we generate citizens' health needs from communities, we sit in our needs based on what the community needs. If community A wants new primary healthcare facility in their community, management agency. If their concern is around services, then we channel it to where agency is concerned with such services. If the need is around infrastructure, then we channel it to the works ministry, the housing ministry, this and that. So we kind of how do I put it? We kind of give Paul what belongs to Paul. Needs for that are meant for primary health care, we submit them to primary, we put them aside and then submit to primary health care. Those for hospital management board, we put them aside and then share with the hospital management board. Thank you.
Okay, thank you for that. So we'll go to the next.
In addition to that, in addition to what my brother have just mentioned, prioritization and need, you may find in a certain community, the citizens, they are demanding for maybe 5 interventions at the same time. And government cannot provide all things at the same time. Government always complain of inadequate and insufficient resources. So what we do, we make a priority among the 5 things that the community submitted. For example, community requested for increased staffing, and they also requested for expansion of the health facility so that there will be much more bed spaces. Or the third thing example, they requested for provision of water supply in the health facility, or they requested for provision of toilet and water. So we sit down and we select the one that is much more priority, and we take it off so that if the government cannot be able to provide this 5 need, at least government may provide one of the 2. So we select which one is much more important and which one will make more greater impact. Then we take it off so that government will start with it, and the remaining one, government will do them later. So this is how we do prioritize, and we rank them based on importance, based on priority, and based on the urgent impact it will provide to the facility. Thank you.
Okay, thank you for that. I can see that Bashir just chatted us on the chat box. Bashir, would you like to take this opportunity to share how you, to share your experience on how you work, Bashir? Over to you, Bashir.
Thank you. Can you hear me?
Yes,
hello?
yes, we can. Yes, we can, Bashir.
Thank you.
Yes, we can.
Yes, I'm Bashir Hassan Abubakar from Nigeria. We were the first pioneer coalition to be set up by Evidence for Action MamaYe. They exited sometime this year, but I'm glad to inform you that the structures they have established has already metamorphosed into a full-fledged government-registered NGO that is duly recognized by the federal government of Nigeria. And since the exit of Evidence for Action MamaYe, we've been carrying out activities. We've been getting support from other IPs like the UHC Integrated Health Program here in Bauchi. They've been very much interested in the scorecards we've been developing over the years. And they've expressed their, hope that they can allow us to now, you understand, start being part of the process of the scorecard development, so that we could equally borrow a leaf from their input and the financial support we are likely to leverage on that. Aside from the UHC Integrated Health Program in Bauchi, even the government itself, they have been paying close attention to the independent scorecards we've been developing, using it as a yardstick to see whether or not they are performing in certain components of the MNCH components of the health sector. And they've been paying attention in the last budget appropriation that has just been signed into law. We actually advocated for, improved releases. Now the target is to improve on releases. Already we have already achieved, the level of getting them to appropriate more funding in line with the Abuja Declaration of the 15% of the total budget. I'm glad to tell you that due to our advocacy and of course other civil society organizations, we're able to get the government pay attention and appropriate much more than the 15% itself. So we didn't stay at that. We have been canvassing for improved releases because we felt that is one area that it can really enhance the performance of the relevant health MDAs in the state. Well, that's how far I can go. Let me allow other people to equally share their experience. Thank you for giving me this rare opportunity. Over.
Thank you so much, and rare indeed it is. So I can see Hawa Salwa. Hawa, over to you.
Please. My own is, I want to know if slums realize that donor partners play a very important role in pushing and ensuring improved health services, in our various countries and states. But the achievement in health sector will be reversed if donor partners exit. And this is our fear, and this is what we have learned in Kaduna, because in most cases, there are releases without cash backing. And I don't know if other slums realize that, in the course of their work. So I think we should all look for other sources of mobilizing resources like we are doing in Kadman with our strategic plan on resource mobilization to help continue or sustain what we are doing right now, for improved health services in various places. Thank you.
Thank you for that, Hawa. So we're about to wrap up, so let's please be brief. I can see there we have Elizabeth Apondi from the MNH Coalition. Please, would you like to air your views? You can even highlight key learnings as we come to the end of this session. I can also see Ishaku Adamu. So Elizabeth, you can go first, then followed by Ishaku Adamu from the Yobe Voice and Accountability Mechanism. Thank you. Over to you, Elizabeth. Okay, as Elizabeth is still preparing herself, can we have Ishaku Adamu? I can see you in the house, Ishaku. Would you like to take this opportunity to share? Oh, he just I can see that he just left, but I still have in attendance Mariam Mohammed. Finally, I can see your hand, Mariam. Your inputs briefly. Welcome. Over to you, Mariam. Mariam. Mariam Mohammed, unmute. Okay, so I can see that you're texting them. I can see Liz, we can hear you now. Over to you, Elizabeth. Okay, it seems like I can't get to hear these people, but I can get to read. Elizabeth Apondi, I can see you're ready. Take it over, Elizabeth. Seems like she's facing some technical issues, so maybe I can just read. I can see from Mariam Mohammed. She's saying that Constance Kimilu from Bungoma Ramka, insightful engagements from the coalition, take-home approaches and experiences learned in improving our advocacy outputs. Wonderful. Priority outlining of steps to action can help to improve our achievements. Thank you. Elizabeth, I can see that you're still texting. Are you able, you can take it up.
Sorry, I have two questions to Kaduna Slam. I don't know if I can have response from them.
Yes, please take it up briefly so that they can get to respond.
Okay. My question is that they made mention that they are able to achieve 15% Abuja declaration budgetary allocation to health. Please, I want to know what is their budget performance? Does the release of the budget reach that 15% that is being allocated to health? The same question also goes to Bauchi Slam. They made mention that they have achieved 15% budgetary allocation. What about the releases and the budget performance? Do they have 100% release from the budget allocated to health? Thank you.
Thank you, Dr. Damu, for keeping your promise. Over to you, panelists. Please do get to answer that.
Kaduna, yes. Yeah, Kaduna, from what I have said, we have been following through the budget performance quarterly, and from the performance that we have seen, There are different performance from both the capital and recurrent expenditure. Our concern is more on the capital expenditure actually, because that's where the work is. And what we used to see is that you see the highest that we got in the last 3 years is about 90% cash backing, or the money that is released for the job, over 90%. But in the last 3 quarters of this year, we have about 73% actually. And I'm not sure whether they can make it up for 90, by the end of this December. But I'm sure you will be able to reason within yourselves that, the issue of finances across the country, across all the sub-nationals, is really not very encouraging. So that affects the performance generally. And that's why in Kaduna, they have what they call the liquidity committee, which is directly responsible for allocating funds after releases, because we have releases and then we have cash backing.
Yes.
And we try to monitor that one very closely. And then we pay advocacy to the government, to ensure that releases, cash backing are given to particularly the health sector to meet up with the budget allocation. Thank you.
Thank you. Thank you for the response.
Thank you for that response. I can see that time is up. I would like to pass it. Thank you all for your inputs. I know that there's a lot of people who would like to ask questions and their views, but I would like to pass it back to Bunmi. So over to you, Bunmi.
Thank you very much, Fred. Thank you so much to everyone who has, taken out the time to attend this peer-to-peer advocacy learning event on, Universal Health Coverage Day. And we cannot help but be amazed at the quality of conversations, the quality of discussions that we were able to produce in just this 2-hour time span. So many thanks to the organizers of this peer-to-peer learning advocacy events, talking to Evidence for Change, MamaYe, and also Options. The goal of this event was basically to bring together the coalitions, the networks, the other advocacy organizations to speak to the work that they have done, the outcomes and the outputs, the challenges also, and the learnings from each of their work in their various countries, Nigeria and Kenya, and also present an opportunity for we, the audience, to learn from it, and also for countries to learn from each other. And we are here just to, acknowledge the progress that we have made to, universal health coverage as countries, as regions, as states. Speaking to Yobe State, Kaduna State, Kano State, for example, and the other states. And also learning on these experiences from the various CSOs, the various advocacy groups, and the media organizations and advocacy organizations like Nigeria Health Watch on how to promote accountability. And we have learned from these organizations on the role of multi-stakeholder collaboration. So these are the overarching themes from this conversation: multi-stakeholder collaboration, governance, community engagement, and financing in achieving sustainable health outcomes. And we have also learned from participants from Kenya, Nigeria, Ghana, South Africa, and other African countries. And I would just like to add that this was indeed a cross-learning experience across borders here. So 2 minutes more to go. I don't know if Meshach has anything to add. I'll just hand over to Meshach and just to end this session and to say once again, many thanks to the participating organizations, many thanks to the presenters, and many thanks to we, the listeners and the delegates. Over to you, Meshach. Thank you very much.
Thank you so much, Madam Moderator, and to the planning team that really put this together. We greatly appreciate the efforts. Just to say that we've really had the call that was loud and clear that there's need for more these peer-to-peer learning opportunities. And at Evidence for Action MamaYe, we shall continue to convene civil society and media, and we were even told to bring in government participants so that you guys can continue to hold these conversations in future. We are really hoping to build more on that. On the website link where we had shared details about this event, there's an email there. We greatly encourage feedback and ways in which we can continue to collaborate in future. We all have a role to play as we advance universal health coverage as civil society actors, as media, essentially just reminding political leaders of their commitments they made to improve lives of women, girls, and everyone else as we pursue the Health for All agenda. Thank you very much, and we truly appreciate you for making time to join us. Thank you.